The learners that come to us at Repro TLC are such a unique group of individuals because these aren't people who are here because it's on their list of requirements and it's a box to be checked off. These are people who have spent their lives working towards whatever medical or healthcare profession because they want this to be the outcome. Like, they want to be able to provide these new skills and this new knowledge that they plan to integrate into their practice and that they plan to use to improve the lives of the patients and clients that they're caring for.
We're resisting the medical hierarchy that says that just physicians or just surgeons deserve access to training in abortion care. We want all providers who are meeting patients where they're at to be knowledgeable, skilled, and confident in this type of care.
A provider is just not somebody who's an MD, right? Somebody we see on like Grey's Anatomy. We like to see different type of providers. There's so many different type of providers: doulas, midwives, APCs, nurse practitioners, all these people that are doing this important reproductive health. Anybody that comes in contact with a person who is accessing any type of healthcare is a provider. So even abortion doulas who support people having their abortion at home are a type of provider.
To have training sites nationally available so that people can truly be supported in learning and the muscle memory and the practice and the counseling and then being there for people across all gestations is really a unique feature of Repro TLC. And others in the field who've started training across specialties continue to look to us for our expertise in the field, for our leadership in the field, and the knowledge that we have not only of licenses, but also of the ways that all of our training partners practice to be able to best match trainees with what they're seeking to gain expertise in.
Our intention should not be to just complete a visit, but to allow our patients to have control over the visit. So really that it is our job to disrupt a power dynamic in an exam room or in a clinic.
Provider movement building comes from the realization that in the last 18 years, we have trained hundreds and hundreds of care providers around this country. We have provided over 4,000 days of individualized clinical training. And so we have this network of passionate providers around the country practicing reproductive health care. And that is our greatest untapped resource. With provider movement building, we have an organizer who is meeting with providers, learning from them what they need to be able to provide the highest quality care, what their patients are asking for, what are the barriers and challenges to implementing that care, and then looking for opportunities to not just fill gaps in training, but actually one day to eliminate them.
Where Repro TLC is at this moment makes me so happy. It's so gratifying to see all these systems, this real focus on equity. So it's not just can we get trainees in the door, but who are the trainees that are going to really make the biggest difference? What is their own background? What barriers have they overcome to get to the point that they are in their training or their career? And how are they going to bring that life experience to their patients and to the communities that they serve? So one of the questions that we ask that I feel really exemplifies the organization's work is, if not for our training, this person wouldn't be able to provide services. And because they got this training, they're going to make a difference in their community. And that's the clinician or the future clinician that we really want.
You don't need to solve the problem. You just need to engage every day. You need to move the advocacy, the efforts, the contributions forward. You need to stand up every day and be a part of the solution. Maybe you aren't the one who ultimately gets to the solution, but we have the ability to every single day work together in community to move ourselves toward the world we want to be living in. And so that is what we need to do. And that's how you can get out of bed every day, because you know that when you go to work and to do the work that we're doing, that it is hopefully improving the world, and at some point we'll get to a place where it's the world we want.